Ladies and gentlemen, this session is on disrupting the consumer space, and our moderator, Ms. Ajita Shashidhar.
Good evening, everybody. I'm sure you're having a great time today, and I hope the Maiden Fortune India Startup Summit has been extremely insightful for all of you. So, all of us are hearing about how AI is the biggest disruptor. But I also think that there are a lot of startups who are disrupting traditional businesses, which I don't think any of us would have ever imagined being available on a digital platform. I would like to start with you, Siddhartha, and then move to Saumyajit. So you are disrupting a segment like healthcare, and Emoha is disrupting. You're making senior care accessible, which was unthinkable a few years ago. So it'll be interesting to hear from you as to how you're making these very traditional businesses accessible to the consumer through digital platforms.
In Motar, in all cases where procedures, diagnostics have to happen, it has to be at site, right? But what happens before and after can really be disrupted. How consumers discover which is the right provider for their exact use case is what we have been trying to change. The more data and options we're able to give to consumers, the better choices they make. And what we really believe that if a consumer was to research on Practo and then decide on their part on their healthcare journey, the health outcome should be better than not doing this. The choice in the past was ask your neighbor, ask your family and friend, and then decide on the provider where you're going to go for something as small as a dental checkup to something as massive as a coronary procedure. But on Practo, we have now been able to collect a couple of about 30 to 40 million data points about Indian providers. This goes from the fact that a certain doctor is credentialist to complete a procedure, which means he has had the education. He works in a hospital in a location which has the equipment to deliver the care. He's also had past successes and good outcomes on the procedure. And we've actually sent physical survey teams to hospitals to actually validate all of that data. So now all of that data is available to consumers, and now AI agents are making it really possible and making it very accessible for consumers to consume. That just changes the transparency in and out completely, which is why we think a lot of disruption has happened and is about to happen in healthcare.
What did it take to build trust? Because getting a consumer to, click on a digital platform to take a doctor consultation is not really easy. So what really did
Absolutely.
it take?
And I think in healthcare, it just takes a lot more time than in many other categories. There has been no way to subsidize your way to trust here. It's about doing the right thing over and over for now about 17 years that we've been at it. I think one big inflection point definitely was COVID, in which a lot of consumers tried a digital consult for the first time. That really changed how fast the adoption rates have changed. But I think it's about repeatedly doing better and better medical outcomes, and that talks for itself.
Coming to you, Saumyajit, how difficult was it to get senior citizens to even, subscribe to your service?
First of all, Ajita, thank you so much. It's a pleasure to be here. Facebook is an elder care app. Would you agree? Facebook, elder care app. Early in the days when Emoha started, Emoha, the word means a home. So, being 17 years now in the elder care space, and I come from an architectural background, trained in developing senior living facilities, I always used to think that, old age homes never in India. But good thing is, India is also evolving. We are seeing a lot of seniors wanting to shift into, senior living facilities. But 99.5% of India's 140 million seniors are wanting to stay in their own home. And the good news is that they are becoming more and more digitally savvy. How many of you have seen your grandparents and moms and dads sending, good morning messages on WhatsApp and, all of things? They are digitally savvy. So when Emoha started a year before COVID, and when COVID happened, we suddenly realized that, this physical events and physical activities is not going to work. So we had to immediately, kind of transform. We started in Delhi, in Gurgaon, but now we are pretty much across the country, large offices in Bangalore. And we had to reinvent and create the trust that comes in from what we call as an Emoha daughter. An Emoha daughter who is a care coordinator talking to an elder bunch of 40 elders visiting them once in a while, but then digitally being available to them, meaning calling them on the app, being, visiting them, taking their longitudinal healthcare data, and ensuring that there is an emergency, whether it's a wearable, whether it's a tap on the phone, whether tomorrow an AI agent, we are able to detect it. And that's the power of being able to help our parents age magnificently, but in their own home. Each one of us sitting in the room have our moms and dads somewhere. And we can't say for sure that they are fine right now. But with a subscription, with a confirmation that technologically, digitally, there is somebody who's putting a wrapper around the home, having laser sensors in the home, I can guarantee and I can assure that the response is much more faster. And that's the trust that digitally we can do together, and not just let it for nature or Mother Nature to play out when danger happens. 25% elders have falls. And I'm sure many of you have heard horrible news of somebody's had a fall, broken hip, and then having issues. 2 out of 4 elders are lonely. This is Government of India statistics. And 3 out of 4 have chronic issues. It's not a very happy story, but the reality is that's the one thing each one of us in the room will go through at some point of time. So we better equip ourselves. The new elder is going to be more and more digitally savvy. It seems like I have come to an AI conference, Ajita. And the good part is that a lot of international statistics are saying that elder care and care industry is going to be least kind of impacted from AI, but the most powerful from AI enablement. So how can I create AI companions? I think the last panel was talking of companions, like Emoha daughters, a lot of healthcare data, agents, patterns, being able to predict which direction an elder is going to. So it's absolutely exciting times. We have 300,000 seniors now on the platform across 40 cities, saved more than 1,500 lives, and growing very fast. But what we want to do is also grow in the right way, so that every mom and dad, every uncle and auntie who's coming to our platform is truly taken care.
Coming to you, Shashi, you're disrupting across income levels. And the packet of milk that one can buy from a cooperative is, there's a huge gap there. So how are you kind of convincing consumers to buy? Is it, obviously you are priced at a premium, but how are you getting the mass consumers to buy your product?
So I think there's a lot of misunderstanding of what consumer is wanting these days, okay? At least my experience from past 16 years says that while the consumer continues to buy, what he is buying, why he continues to do what he is doing, but when it comes to his family, his children, the thought is very different, okay? For my child, let me get, something which I didn't have access to. So that's how I think the next generation consumer is building. That's the most conscious consumerism you can ever see. Okay, can I buy a milk which is free of antibiotics? Can I buy a milk which is free of hormones? Can I buy a milk which is free of aflatoxins? Very simple decision making for mothers and fathers for their children. So that's the moat, a strong moat for any brand to build. So the way that translates into consumer action is, for example, if you really look at last financial year, 45,000 consumers of Akshayakalpa, they have visited our farmers. So that is something which is changing. People have started asking questions. While they want access to good food, they started asking questions. Where it is coming from? Who is growing it? How it is being grown? What cost it is being grown? And what chemicals they are using to grow that? So those questions are becoming very, very relevant in consumer minds. I think consumer has woken up, is asking questions. I think brands will be put into a lot of tests. So therefore, the pricing becomes immaterial. If you can deliver on the promise, of what you're doing, and I think the pricing is matter of detailing. That's how I really look at. Gone are the days where you're building markets on pricing. These are the days, where you can build, substantial markets based on the promises which you can stand for. That's how I really look at it.
Interesting. Coming to you, Rishav, now let's get an analyst perspective. So what are the various vectors through which, the consumption space can be disrupted?
See, and probably it's a single thread which runs across all three that we have on the other side who are entrepreneurs. See, there's a very interesting confluence of supply side and demand side factors that are playing out right now. If you look at, there's a whole term called supply creating demand, right? No one knew they needed delivery in 10 minutes, but actually they did. So what's happening is at one end, you're using digital on the supply side to create, very hyper local targeting to the consumer to meet their demands. There is an entire omni-channel journey which is flowing where consumers discover offline and then they buy online, all supply side driven. You're creating products and services like people on the side where the consumer wanted that product and service and was willing to pay, but none existed. So there's an entire supply side availability-led change that's happening for the consumer, which is mostly powered by digital. And very interestingly, you mentioned digital has no age. I think that's really coming up, right? Because on the demand side, the disruption that's happening is on A, information, B, payments has created a massive digital economy where adoption of as high trust as money has gone through digital, where you can pay anybody and everybody in a span of probably 10 seconds. And then on the other side, information arbitrage is completely gone now. So everybody wants that information and everybody wants that information at that point in time. And the hunger for that awareness, as you were saying, Shashi, has actually gone up manifolds. Now, if you join the two together, where the supply is meeting this kind of consumer, you are creating very different profiles of consumers. At one end, you are creating a consumer which is selectively premium. The same consumer will buy a 30 rupee milk for them, but buy a 3,000 rupee ghee for the kid. The same consumer will probably be the most savvy at 60 years of age because the 14-year granddaughter is teaching the grandfather a lot. The same consumer will be one who would be extremely high, zero latency consumer because they would want everything in 10 minutes because that much time they have in the day. So the consumer archetypes we are seeing evolve is actually quite different now because of the confluence of what's coming from the supply side and the demand side. And I think digital is the heart of it, and that's what is going to drive the new consumer and probably the challenge for everyone on this side to create and meet.
That's really interesting. So it is, the consumer is across age groups, demographics is becoming more digitally savvy. And also this whole trend for having good for you products, this whole consciousness of buying good for you products. And that's why they're willing to pay a premium. Rishav just touched upon an omni-channel strategy. That's where I would like both of you to come in. Again, how important is it for a healthcare platform, a digital healthcare platform, also to have a brick and mortar presence?
Right, so service delivery for us is definitely hybrid. I mean, it is phygital, the business is phygital. Most consumers come to us to find a doctor they want to meet in person tomorrow, day after, over the weekend. And to guide them is what happens on the platform. But final care delivery is there. And right after that appointment, we again handhold the consumer to figure out what next. Meeting the doctor is mostly the beginning of a health episode, right? You may have medical management to be done, you may have diagnostics to be done, you may have a second opinion that a lot of consumers now consider. And in a lot of cases, consumers then get prescribed a probable procedure, which is they're facing that for the first time in their life, right? Somebody has to spend a couple of lakh rupees and go through a life-changing surgery. And that is the time consumers come to us and again have a lot of questions about how am I going to pay for it, where can I get it, what are the technologies that are available, and all of that is what our team helps them out with, our product helps them out with. And then, of course, the final delivery is going to be in the physical world. So the business is kind of digital for us in the first place.
Saumyajit, you have got into the senior care living space recently. So again, it'll be interesting to hear from you as to how you balance the both.
See, the fundamental premise is that an 80-year-old who's had a fall at 2 a.m. in the morning, what will digital do? Beyond a point of time when a doctor is looking at the pulse of an elder, what will digital do? How do you get trust? So for us, it was very clear when we started in Delhi. I stay in Gurgaon, and I divided Gurgaon into 4 parts. I'm an urban planner. I look at India as 400 hyperlocal markets. Each hyperlocal market is 5 lakh population. 5 lakh population has 50,000 elders, 10%, and 50,000 has roughly about 5,000 of my, addressable market. So unless and until I am hyper local, unless and until I can go and meet the elder, when I'm saying I, it's ranges of carers. Carers could be the Emoha daughter, the doctor, the nurse, and so on and so forth. But unless I can go and physically touch the customer, it's not going to work. So we actually chanced it by accident. We were seeing near 95th percentile renewals in places where our Emoha daughters were going and visiting them. And that was early in 2018-19. And then it became law. So even in Bangalore today, Bangalore has been divided into about 20 hyperlocal pockets. Each hyperlocal pocket has nursing officers in place. We're headquartered in MG Road, but all these pockets have local, nurses and Emoha daughters. Now that touch point with an elder just changes the game. Because when you go to an elder's home, however much we are digital and technology and app, we get to see uncle and auntie in their true avatar. And we see the picture of young, handsome, 25 years old, the Indian Army officer, and speak about that story. That trust cannot be done on an app. So it's always going to be that conversational touch point. Tomorrow as Emoha grows, we will also have daycare facilities, we will have physical facilities, so it just amplifies the trust, but both digital and physical will coexist.
So an omni-channel presence is mandatory.
Yes.
You just can't be digital only. It has to be, you could be digital
Yes.
first, but you have to have a brick and mortar presence too. My next question to you would be Shashi, and then I would come back to Rishav again. This is a question on profitability. So disrupting, coming up with out of the products is great. Coming up with price disruptions, all that is great. But what do you really, how important is it to, build a profitable model so that you can sustain for the long term?
I think it's absolutely critical. In my opinion, at least brick and mortar companies like us, and with a digital distribution and back end, it is farming. Okay, from farming getting into manufacturing, manufacturing coming into physical product movement. Okay, and of course, okay, order booking, all of it happens through digital. Profitability will be the key. It will be measured in paisas. It is not definitely in rupees. Okay, we need to really get that unit economics at every level organized, starting from farming, okay, to manufacturing, okay, to distribution, okay, to end consumer. Okay, the entire end-to-end value chain, it's very, very critical. Without that, I think companies like us is extremely difficult to survive. So it is, it is not a software play, okay, though there's a digital distribution, but physical goods movement are involved, so therefore profitability will be the key. Without that, it's very difficult to sustain.
Interesting. Rishav, I'll come to you, and I'm sure you advise a lot of startups. So, where does profitability play? What kind of a role does profitability play when it comes to, creating a disruptive model? What do you tell them?
Profitability has become the heart of the conversation now. Because, if you look at the startup journey in the country, as startups, about 15 years back, 17 years back, we were solving for a lot of inefficiencies. And you'll realize that disruption in supply chain, disruption at logistics, creating consumer preferences by supplying online, and so on and so forth. All that efficiencies got funded on a future belief that the consumer will change. Now the consumer has changed. So the test has come in to say that now will the consumer pay, and now can you create a profitable franchise? And it is becoming relatively possible also. Now I'll tell you, for example, you spoke about hyperlocalization, right? Sachi, and Saumyajit, the fact is that today, if you break up the consumer in multiple hyperlocal, there is a capability where you can target a consumer in a 200 by 200 meter block of any city with the kind of service you want to go to, the kind of consumer you want to go to. So that level of accuracy exists today with multiple sets of information, whether it's mobility, whether it's geospatial, any of those, right? Then the consumer, we did a survey, realized that 75% of consumers actually search online before purchasing anything offline. Now think about it, right? If you look at a store which is selling probably, lab-grown diamond jewelries at 20,000 bucks a pop, the store which used to be earlier doing X amount of revenue can do 1.5x because the consumer actually searches online, exactly knows what is to be bought, comes offline to see the product, and actually makes the store revenue go 1.5 times. And that gets profitability. So what I'm trying to say is that the question of profitability has become the front and center, not because it's time, it's also because there are business models who are proving that profitability is possible. At a certain level of value chain, that profitability is coming by. So hence, it's not a question anymore.
I wanted to also add, Ajita, that I think 6 years back when I started, I wish AI was there. Today, in our discussions, it's so much more powerful today to eliminate, whether it's supervision inefficiencies or managerial inefficiencies. In the last 1 year, we've been able to bring our overheads down by 50%. And this is only possible because what has happened in the AI world in the last, year, which was not there. So profitability has become more and more possible because of what is happening. Otherwise, companies like us, which is more physical, it's difficult to scale with profitability. So AI is actually helping us today to kind of venture in that direction.
And absolutely, I think the AI point is so pertinent, Saumyajit, because it's not unidirectional to say that it's going to cut jobs necessarily, right, only. But there are so many efficiency factors that come in. Marketing has become more efficient. Processes have become more efficient. We do so much of work using AI on, for example, customer management, customer service, call center management. There's so many things which have become far more efficient on the back of using AI, and we've seen that benefit to our clients as well, and that's actually helped.
So we are actually coming to an end to this conversation, and I cannot end this conversation and without asking a couple of more questions on AI. So maybe Siddhartha, you can, and let's make it a little anecdotal as to how you're using AI to your benefit.
Sure. I think it's cutting across functions like everyone's already talked about. It started off with a cost-saving measure in a lot of places where operational inefficiencies could be reduced. We could do more, less supervision required, a lot of process automation. So we've been doing automation for maybe about a decade now, but it just took another level in the last 12 months. I think one big anecdote that I can give you an example. So consumers who call up our providers often would end up not being answered, or being answered delayed, or being answered with somebody who is not handy with all the information. You could call a multi-specialty hospital and ask about a particular type of procedure that is done with a machine, and the operator on the other end may just know. And he says, I'll call you back, I'll hand you over to a different department. Today, if you were to call any hospital provider on Practo, you will get answered by an AI agent who has availability of all the doctors across all the departments, knows all the prices, knows all the facilities available, and that just delights the consumer on the first 30 seconds of the call. He gets from a query to a pointed answer immediately and gets a physical appointment booked on the same call. So that's one real consumer delight feature that we've been able to launch. But other than that, internally, I don't think there's any team at Practo who's not at breakneck speed in a war room mode deploying some AI or the other right now.
Thank you. Shashi, let's have the final word from you as to how you are using AI to disrupt a category like dairy.
No, very interesting. So it's on the consumer side story, it's very interesting. It's very hard to imagine, isn't it? A 3-member technology team can deliver a product which can do 30 crores a month. Okay, so that's the level of sophistication AI has gone in. Okay, last 1 year is a massive adoption within the organization on AI. Okay, and all the coding, 90% of the coding is right now, okay, on the consumer side app, and also the farm side, okay, entire work now, okay, it is AI. 3 people do it, okay, and with 1 QA fixing, that's it, okay. 1 product generates 30 crores a month. So that's the scale at which we operate. I think that's the power of AI. And if we don't realize it, I think it's going to be, if that were to be done in a conventional system, maybe 2 years back, okay, it is a 25 to 30 member, okay, team sitting there and checking in a sweatshop. So can you imagine? So that's a change, yeah.
That's really interesting. Thank you so much. Thank you so much for speaking to Fortune India, and thanks a lot. It was such an insightful conversation. I really hope all of you enjoyed as much as I did moderating this panel. Thank you so much.
Thank you very much for that very engaging session. Ajita, I'd like you to please present a token of appreciation to our panelists, please. Right, so that was a very engaging session, conversation especially on how consumer expectations are evolving and what it takes to stay relevant in the industry.